Check. Mic check 1 2. Mic check 1 2. Check 1 2. Mic check. Check. Mic check. Mic check. Mic check 1 2. Mic check 1 2. Mic check 1 2. Testing 1 2. Testing mic 1 2. Mic check 1 2. Mic check 1 2. Mic check 1 2. Mic check. Feedback. Mic check 1 2. Mic check 1 2. Mic check 1 2. Mic check 1 2. Mic check. Check 1 2. Check 1 2. Mic check 1 2. Mic check 1 2. Mic check 1 2. Testing 1 2. Testing. Mic check 1 2. 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 Testing 1 2. Yeah, mic check 1 2. Yeah, mic check 1 2. Yeah, good. No feedback.
Check 2, 1 2. Testing 1 2. Two. Check 1 2.
Hello. He's still doing the same thing. Oh yeah, so testing. Okay. This one too. Can you test it, Anchor?
Hello, 1 2 testing, 1 2 1 2. Hello, 1 2. Right.
And actually, I should be using my voice because it. Not saying my gun. I just want to be sure of the. Hello. Testing 1 2 microphone check. Hello. Testing 1 2 microphone 1 2. Testing. Hello. 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 Testing 1 2. Testing 1 2. Microphone check. Testing 1 2. Hello. Hello. It's okay. It's okay.
check. 2, 2, check 2. 1, 2. 2, check 2. 2, check 2. 2, check 2. 2, check 1, 2. Check 2. 2, check 1, 2.
If you deal with photos or videos in any capacity, you've probably encountered various
Testing microphone. Hello. It's not loud enough, Sha. Hello. Hello. Microphone check. Hello. Testing 1 2 microphone check. Hello. Hello. Hello.
Your Excellencies, all very distinguished ladies and gentlemen, A very good morning. May I please request that we all find our seats and be comfortably seated. Any moment from now, we would have with us the Mother of the Nation. So it's important that we're all seated, please. Particularly the aides to the very important people that we have with us this morning. Please ensure that you leave the aisle and be seated, or find your seat where you can be comfortably seated. The aides, please, should be at the back of the hall. The aides should please be at the back of the hall. Thank you.
Delivered to the population for the benefit of the vaccination to be obtained. The national launch of this effort will take place on October 24th, 2023 by His Excellency President Bola Ahmed Tinubu, GCFR, President and Commander-in-Chief of the Federal Republic of Nigeria. I urge all parents and leaders in the first phase states, 15 states and the Federal Capital Territory where this will be initially rolled out, to ensure that their children that are eligible to receive these vaccines through their schools, through their communities, and through providers, to ensure that we protect the future generation of women and adults in Nigeria from diseases due to the human papilloma virus, such as the cervical cancer. This is an important effort that the government and its partners have come together to deliver, and we count on all of us Nigerians, leaders, parents, mothers, fathers, grandparents, to come together. As the coordinating Minister of Health and Social Welfare, and also as a father, I strongly urge and advise all parents to ensure that their eligible children receive this potentially life-saving vaccine that can prevent cervical cancer. Fellow Nigerians, consistent with President Bola Ahmed Tinubu administration's renewal of hope agenda, the Federal Ministry of Health, through the National Primary Healthcare Development Agency, is launching a national effort to prevent cervical cancer among women in Nigeria by administering the human papilloma virus vaccines. Annually, at least 12,000 women are diagnosed with cervical cancer in Nigeria, and almost 8,000 of them lose their lives. The human papilloma virus vaccine can reduce 90% of those cervical cancer cases among our women, but it has to be delivered to the population for the benefit of the vaccination to be obtained. The national launch of this effort will take place on October 24th, 2023 by His Excellency President Bola Ahmed Tinubu, GCFR, President and Commander-in-Chief of the Federal Republic of Nigeria. I urge all parents and leaders in the first phase states, the 15 states and the Federal Capital Territory where this will be initially rolled out, to ensure that their children that are eligible to receive these vaccines through their schools, through their communities, and through providers, to ensure that we protect the future generation of women and adults in Nigeria from diseases due to the human papilloma virus, such as the cervical cancer among women. This is an important effort that the government and its partners have come together to deliver, and we count on all of us Nigerians, leaders, parents, mothers, fathers, grandparents, to come together. As the Coordinating Minister of Health and Social Welfare, and also as a father, I strongly urge and advise all parents to ensure that their eligible children receive this potentially life-saving vaccine that can prevent cervical cancer. Fellow Nigerians, consistent with President Bola Ahmed Tinubu administration's renewal of hope agenda, the Federal Ministry of Health, through the National Primary Healthcare Development Agency, is launching a national effort to prevent cervical cancer among women in Nigeria by administering the human papilloma virus vaccines. Annually, at least 12,000 women are diagnosed with cervical cancer in Nigeria, and almost 8,000 of them lose their lives. The human papilloma virus vaccine can reduce 90% of those cervical cancer cases among our women, but it has to be delivered to the population.
President, Nigerian Society for Colposcopy and Cervical Pathology. The Federal Ministry of Health, through the National Primary Health Care Development Agency, in collaboration with partners, will be introducing the human papilloma virus HPV vaccine against cervical cancer and other papilloma virus related diseases. Annually, over 12,000 women are diagnosed with cervical cancer in Nigeria, and about 8,000 women die from this vaccine-preventable disease. The introduction of the HPV vaccine will reduce the incidence of cervical cancer by over 90%. The vaccine will be launched on Tuesday, the 24th of October 2023 by His Excellency Bola Ahmed Tinubu, GCFR, President of the Federal Republic of Nigeria, for Phase 1 in 15 states and the FCT. As President of Nigerian Society for Colposcopy and Cervical Pathology, and as a father, I strongly advise that all parents and caregivers should ensure their daughters, nieces, and wards are vaccinated with the HPV vaccine. I urge you all to secure the health and future of the girl child by seizing this opportunity for all girls 9 to 14 years to take the vaccine. Please remember that 24th to 28th October 2023 is the period for the HPV vaccination campaign in schools, communities, and in all primary health care centers in the 15 Phase 1 states and FCT. Thank you all. God bless you. God bless the Federal Republic of Nigeria.
Fellow Nigerians, consistent with President Bola Ahmed Tinubu administration's renewal of hope agenda, the Federal Ministry of Health, through the National Primary Healthcare Development Agency, is launching a national effort to prevent cervical cancer among women in Nigeria by administering the human papilloma virus vaccines. Annually, at least 12,000 women are diagnosed with cervical cancer in Nigeria, and almost 8,000 of them lose their lives. The human papilloma virus vaccine can reduce 90% of those cervical cancer cases among our women, but it has to be delivered to the population for the benefit of the vaccination to be obtained. The national launch of this effort will take place on October 24th, 2023 by His Excellency President Bola Ahmed Tinubu, GCFR, President and Commander-in-Chief of the Federal Republic of Nigeria. I urge all parents and leaders in the first phase states, the 15 states and the Federal Capital Territory where this will be initially rolled out, to ensure that their children that are eligible to receive these vaccines through their schools, through their communities, and through providers, to ensure that we protect the future generation of women and adults in Nigeria from diseases due to the human papilloma virus, such as the Excellency Mr. Bola Ahmed Tinubu, GCFR, President and Commander-in-Chief of the Federal Republic of Nigeria. I urge all parents and leaders in the first phase states, the 15 states and the Federal Capital Territory where this will be initially rolled out, to ensure that their children that are eligible to receive these vaccines through their schools, through their communities, and through providers, to ensure that we protect the future generation of women and adults in Nigeria from diseases due to the human papilloma virus, such as the cervical cancer. This is an important effort that the government and its partners have come together to deliver, and we count on all of us Nigerians, leaders, parents, mothers, fathers, grandparents, to come together. As the Coordinating Minister of Health and Social Welfare, and also as a father, I strongly urge and advise all parents to ensure that their eligible children receive this potentially life-saving vaccine that can prevent cervical cancer.
Dear Nigerians, I am Dr. Yinka Olaniyo, consultant, obstetrician and gynecologist, and president, Nigerian Society for Colposcopy and Cervical Pathology. The Federal Ministry of Health, through the National Primary Health Care Development Agency, in collaboration with partners, will be introducing the human papilloma virus HPV vaccine against cervical cancer and other papilloma virus related diseases. Annually, over 12,000 women are diagnosed with cervical cancer in Nigeria, and about 8,000 women die from this vaccine preventable disease. The introduction of the HPV vaccine will reduce the incidence of cervical cancer by over 90%. The vaccine will be launched on Tuesday, the 24th of October 2023 by His Excellency Bola Ahmed Tinubu, GCFR, President of the Federal Republic of Nigeria, for Phase 1 in 15 states and the FCT. As President of Nigerian Society for Colposcopy and Cervical Pathology, and as a father, I strongly advise that all parents and caregivers should ensure their daughters, nieces, and wards are vaccinated with the HPV vaccine. I urge you all to secure the health and future of the girl child by seizing this opportunity for all girls 9 to 14 years to take the vaccine. Please remember that 24th to 28th October 2023 is the period for the HPV vaccination campaign in schools, communities, and in all primary health care centers in the 15 Phase 1 states and FCT. Thank you all. God bless you. God bless the Federal Republic of Nigeria. Dear Nigerians, I am Dr. Yinka Olaniyo, consultant, obstetrician and gynecologist, and president, Nigerian Society for Colposcopy and Cervical Pathology. The Federal Ministry of Health, through the National Primary Health Care Development Agency, in collaboration with partners, will be introducing the human papilloma virus HPV vaccine against cervical cancer and other papilloma virus related diseases. Annually, over 12,000 women are diagnosed with cervical cancer in Nigeria, and about 8,000 women die from this vaccine preventable disease. The introduction of the HPV vaccine will reduce the incidence of cervical cancer by over 90%. The vaccine will be launched on Tuesday, the 24th of October 2023 by His Excellency Bola Ahmed Tinubu, GCFR, President of the Federal Republic of Nigeria, for Phase 1 in 15 states and the FCT. As President of Nigerian Society for Colposcopy and Cervical Pathology, and as a father,
Zainab Shinkafi Bagudin. I am a grandmother, a pediatrician, and an advocate for women's health, especially female-related cancers. Each year, an estimated 8,000 women die from cervical cancer in Nigeria. The actual figure is probably much higher, as many women remain unvaccinated, undiagnosed, and untreated. The Federal Ministry of Health, through the National Primary Healthcare Development Agency, in collaboration with partners, will be rolling out the human papilloma virus vaccine against cervical cancer and other HPV-related diseases. The vaccine will be launched on the 24th of October, that is Tuesday, by His Excellency, the President of the Federal Republic of Nigeria, President Ahmed Bola Tinubu. In all aspects of my work and experience, I have seen firsthand the devastating effect that cervical cancer has on women, their families, and the community. By vaccinating girls between the ages of 9 and 14, we can guarantee them a future free of cervical cancer and save our country from the huge economic burden associated with treating cancers. Remember, the rollouts will hold between the 24th and 28th of October in schools and communities in 15 states, as well as the Federal Capital Territory in Nigeria. Remember the simple adage that says, prevention is better than cure. Thank you for listening. Greetings. My name is Zainab Shinkafi Bagudin. I am a grandmother, a pediatrician, and an advocate for women's health, especially female-related cancers. Each year, an estimated 8,000 women die from cervical cancer in Nigeria. The actual figure is probably much higher, as many women remain unvaccinated, undiagnosed, and untreated. The Federal Ministry of Health, through the National Primary Healthcare
consultants of Society for Colposcopy and Cervical Pathology. The Federal Ministry of Health, through the National Primary Healthcare Development Agency, in collaboration with partners, will be introducing the human papilloma virus HPV vaccine against cervical cancer and other papilloma virus related diseases. Annually, over 12,000 women are diagnosed with cervical cancer in Nigeria, and about 8,000 women die from this vaccine preventable disease. The introduction of the HPV vaccine will reduce the incidence of cervical cancer by over 90%. The vaccine will be launched on Tuesday, the 24th of October 2023 by His Excellency Bola Ahmed Tinubu, GCFR, President of the Federal Republic of Nigeria, for Phase 1 in 15 states and the FCT. As President of Nigerian Society for Colposcopy and Cervical Pathology, and as a father, I strongly advise that all parents and caregivers should ensure their daughters, nieces, and wards are vaccinated with the HPV HPV vaccine. I urge you all to secure the health and future of the girl child by seizing this opportunity for all girls 9 to 14 years to take the vaccine. Please remember that 24th to 28th October 2023 is the period for the HPV vaccination campaign in schools, communities, and in all primary health care centers in the 15 Phase 1 states and FCT. Thank you all. God bless you. God bless the Federal Republic of Nigeria.
I am Dr. Tunji Alausa, the Honorable Minister for State for Health and Social Welfare. The Federal Ministry of Health, through the National Primary Healthcare Development Agency, in collaboration with partners, will be introducing the human papilloma virus HPV vaccine against cervical cancer and other human papilloma virus related diseases. Annually, over 12,000 women are diagnosed with cervical cancer in Nigeria, and about 8,000 women die from this vaccine preventable disease. The introduction of the HPV vaccine will reduce the incidence of cervical cancer by over 90%. The vaccine will be launched on Tuesday, the 24th of October of 2023 by His Excellency Bola Ahmed Tinubu, GCFR, President of the Federal Republic of Nigeria, for Phase 1 in 15 states and the Federal Capital Territory. As the Honorable Minister of State for Health of the Federal Republic of Nigeria, and as a father, I strongly advise that all parents and caregivers should ensure their daughters, nieces, and wards are vaccinated with the HPV vaccine. I urge you to secure the health and future of our girl child by seizing this opportunity for all girls 9 to 14 years to take the vaccine. Please remember that 24th to 28th October 2023 is the period for the HPV vaccination campaign in schools, communities, and in all primary healthcare centers in the 15 Phase 1 states and FCT. Thank you all. God bless you. God bless the Federal Republic of Nigeria.
Dear Nigerians, I am Daju Kachilom, MNI, Permanent Secretary, Federal Ministry of Health. The Federal Ministry of Health and the National Primary Healthcare Development Agency, in collaboration with partners, will be introducing the human papilloma virus HPV vaccine against cervical cancer and other human papilloma virus related diseases. Annually, about 8,000 women die from cervical cancer in Nigeria. The introduction of this vaccine will reduce the incidence of the cancer by over 90%. The vaccine will be launched on Tuesday, the 24th of October 2023 by His Excellency the President, Bola Ahmed Tinubu, GCFR, President of the Federal Republic of Nigeria, for Phase 1 in 15 states and the FCT. As a woman and a mother, I strongly advise that all mothers should ensure their daughters, nieces, and wards are vaccinated with HPV vaccine. I urge you all to secure the health and future of our girl child by seizing this opportunity for all girls 9 to 14 years to take the vaccine. Please remember that 24th to 28th October 2023 is the period for campaigns in schools and communities in 15 states and the FCT. Thank you all. God bless you, and God bless the Federal Republic of Nigeria.
Fellow Nigerians, consistent with President Bola Ahmed Tinubu administration's, the national launch of this effort will take place on October 24th, 2023 by His Excellency President Bola Ahmed Tinubu, GCFR, President and Commander-in-Chief of the Federal Republic of Nigeria. I urge all parents and leaders in the first phase states, 15 states and the Federal Capital Territory where this will be initially rolled out, to ensure that their children that are eligible to receive these vaccines through their schools, through their communities, and through providers, to ensure that we protect the future generation of women and adults in Nigeria from diseases due to the human papilloma virus, such as the cervical cancer. This is an important effort that the government and its partners have come together to deliver, and we count on all of us Nigerians, leaders, parents, mothers, fathers, grandparents, to come together. As the Coordinating Minister of Health and Social Welfare, and also as a father, I strongly urge and advise all parents to ensure that their eligible children receive this potentially life-saving vaccine that can prevent cervical cancer.
Greetings. My name is Zainab Shinkafi Bagudin. I am a grandmother, a pediatrician, and an advocate for women's health, especially female-related cancers. Each year, an estimated 8,000 women die from cervical cancer in Nigeria. The actual figure is probably much higher, as many women remain unvaccinated, undiagnosed, and untreated. The Federal Ministry of Health, through the National Primary Healthcare Development Agency, in collaboration with partners, will be rolling out the human papilloma virus vaccine against cervical cancer.
Shall we please all rise to receive in our midst the First Lady of the Federal Republic of Nigeria,
on the 24th
the Mother of the Nation.
October, that is Tuesday.
And please, can I have the media turn that off? Thank you so much. Can we have the national anthem, please? Together, can we recite the second stanza of the national anthem, which is our national prayer? O God of creation, direct our noble course guide our leaders right, help our youth the truth to know, in love and honesty to grow, and living just and true, great lofty heights attain, to build a nation where peace and justice reign. Amen. Please be seated. Your Excellency, the Mother of the Nation, the First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu, OON-CON. Your Excellencies here present, members of the National Assembly present here, wives of executive governors here present, led by the chairperson of the Governors' Wives Forum, the wife of the executive governor of Kwara State, the Honorable Commissioner, the Honorable Minister of Health and Coordinating Minister for Social Welfare, Professor Muhammad Ali Pate, the Honorable Minister of State for Health and Social Welfare, Dr. Tajuddin Alausa, honorable ministers here present or their representatives. I know that we have with us the Minister of State for the Federal Capital Territory, Dr. Maria Muhammad. We also have with us the Honorable Minister of Education, who is also here with us. Permanent secretaries here, and their representatives. We also have members, executive directors, and directors general of all the parastatals under the Federal Ministry of Health, namely NCDC, NAFDAC, NHI, and of course the National Primary Healthcare Development Agency, who is hosting us today. And incidentally, is the first assignment that the new, fresh Executive Secretary of the National Primary Healthcare Development Agency, this is his very first assignment and very historic, Dr. Muyi Aino. I'd quickly also like to recognize our traditional rulers. They have become the springboard to the development of interventions such as this. And in that way, I'd like quickly to say and present to us His Eminence, the Sultan of Sokoto, Al-Haji Muhammad Said Abubakar III, CFR. Your Eminence, you're welcome. I'd also like to say that our religious leaders have also been in the forefront of ensuring health for all and getting messages, health messages across board. And for this, I'd like to recognize His Eminence, the CAN President, Most Reverend Archbishop Daniel Oko. You're welcome, sir. Also, on the same table with the Royal Highness and His Eminence is His Majesty Igwe Ambassador Lawrence Abuzu, OON, CFR. He's the Eze Ogbunechedo and Chairman of the Southeast Traditional Rulers Council on Primary Health. I'd also like to recognize His Highness Alhaji Abubakar Umar Suleiman Meibade, who is the Deputy Chair, Traditional Leaders Council in the North. His Majesty King Bubarie Jakolo Ibinana Owe of the Egbetemi Kingdom of Bayelsa State is also a member and is also here. I can see my traditional father smiling at me. Forgive me if I have murdered the names, but then I'm learning like every day. We have here also representing all the women unions and groups in Nigeria. The President of the National Council of Women Societies is also here with us. We have with us the Senior Special Advisor to Mr. President on Health, Dr. Salma Ibrahim Anas. You're welcome. I'd also like to welcome all the directors of the National Primary Healthcare Development Agency that are here with us. It's important that this is a collective responsibility, and so we have all our partners that are here with us. We have WHO, we have UNICEF, we have a good lineup of development partners and donors that are represented here today, and we welcome you very warmly. At the time you make your remarks, we would give you all the recognition that you deserve. I also quickly like to recognize the members of the Nigerian media who are going to give visibility to what we're doing here today. Today is your day. We are making history, and I do pray that with history we'll be able to disseminate the right messages that will be encompassing, which will make all of us be part of this. Your Excellency, the Mother of the Nation, today, with the launch of the human papilloma or HPV vaccine, the lives of more than 60 women and girls aged 15 and above can potentially be saved. The timely event of a major milestone in addressing cancer care disparities has come. And I would dare to say that this is a proud and defining moment for us as Nigerians. When we positively act together, we'll get it. And I do pray that today, as we all gather here to be part of this history, we'll also be part of those that will ensure that our mothers that are needing this vaccine and our young girls are given a life-saving vaccine that will help eliminate or put to rest the serious case of cervical cancer in Nigeria. I welcome all of you. God bless our girls. God bless the Federal Republic of Nigeria. And God bless our First Lady who is pushing this. I'm not alone here today because there are gentlemen also here. So it's not just about the girls who would be administered with the vaccine. It's about a collective responsibility as a nation, an inclusive responsibility, as it were. So on the mic with me today, I have Nusa. Nusa works with the Primary Healthcare Development Agency. Together, we would be anchoring this event, which I consider a privilege because for long, we have advocated for HPV vaccine for our girls, and today is here. So please, let's all of us, let's put our hands together for the history that we are creating today. And so as we continue with the program, with the smiles, with across people, commissioners from the states, representatives of all, some of the first ladies that aren't here with us, I think that the time is for us to say, I'm going to promote HPV vaccine. Can I hear that from all of us? A commitment to ensure that this is not just for today, but it will always be for always. I thank you very much. I haven't gotten the commitment yet, but I know the Mother of the Nation is here, so I have your commitment. But if you know that you are part of history and you want this to happen, please can you put your hands together, everyone. So in the spirit of commitment and the endorsement that we need, even from the World Health Organization, I would like to start our goodwill messages with the representative, the deputy rep of WHO Nigeria, Dr. Alex Chimbaru, who would kick off the goodwill messages. I'd like to invite you to the microphone, sir. Thank you.
you the goodwill from the leadership of the Bill and Melinda Gates Foundation. This event aligns strategically with the foundation goal of supporting country to provide opportunity for people to live healthy and productive lives. Saving the life of girls should be a priority for all countries, and today, Nigeria has taken that bold move, and we are proud of the move and solidly support Nigeria in this journey. Congratulations, Nigeria, for this move. HPV vaccine is globally tested, safe and efficacious vaccine, which has the potential of averting about 8,000 deaths in Nigeria between now and 2028. The Bill and Melinda Gates Foundation, working with Gavi, the Vaccine Alliance, and key partners, support the effort of the Federal Republic of Nigeria, Ministry of Health, and NPSCD to introduce the vaccine using global best practices. Single dose for girl 9-14. As part of our commitment to the government, we have provided both technical and financial support to this effort. Our implementing partners are working day and night to support NPSCDA and the state plan and implement a robust HPV introduction plan that reflects varying contextual issues across the country. Combating the prevalence of HPV is in full alignment with our gender equality priority. The first step to ensure that a girl lives a full and economically productive life is ensuring that she is healthy. No girl should die to this or any other preventable diseases. I wish to reiterate the commitment of the Bill and Melinda Gates Foundation to strengthening routine immunization and PSC system in Nigeria, and pledge our continued support to ensure that we work together to improve health outcome and provide economic opportunity. Once again, congratulations to Nigeria for this big milestone. Thank you.
We thank you very much, Jeremy, for BMGF. Next up on the lineup for goodwill messages is MSD, and coming up to the podium would be Zweletu Bashman, the Managing Director, South Africa and Sub-Sahara Africa. Please, can we applaud him as he comes up to the podium? Thank you.
Your Excellency, First Lady of the Republic of Nigeria, honorable ministers and members of the National Assembly, leadership of the NPHCDA, religious and traditional leadership, esteemed guests and dignitaries, ladies and gentlemen, and the incredible girls of Nigeria. Today is a day of admiration and celebration. As the Managing Director of MSD in Sub-Saharan Africa, I want to express my deep appreciation and heartiest congratulations to the Republic of Nigeria for launching the HPV vaccine program. For over 50 years, MSD has been committed to serving patients across our African continent. We've provided therapeutics and life-saving vaccines, including the HPV vaccine, to more than 20 countries in Sub-Saharan Africa. Today, I stand before you with deep admiration. I'm proud to announce that Nigeria boasts the largest MSD-supported HPV vaccine program in Sub-Saharan Africa. With the introduction of this vaccine, you are taking an extraordinary step towards achieving our shared vision of eliminating cervical cancer in Africa. In a country where women play an indispensable role in society, this initiative holds profound significance. It ensures their well-being, guarding their dreams and aspirations against the scourge of cervical cancer. Allow me to emphasize MSD's unwavering support for the successful HPV vaccine program rollout. Our commitment transcends merely just providing vaccines. We aim to partner with countries to ensure the effective and sustainable rollout of programs, and Nigeria is no exception. Today marks the launch of this program, and we are thrilled to lend our support. Together, let us forge ahead, hand in hand, as we strive to eliminate cervical cancer from Nigeria. Once again, I extend my warmest congratulations to the Nigerian government and all stakeholders on reaching this significant milestone. I thank you.
And we thank you very much. Ladies and gentlemen, please can we welcome to the podium for a goodwill message, Dr. Phil Tallboy for USG. He's the Director of Global Immunization Division. Dr. Tallboy, please.
Your Excellency, the First Lady of the Federal Republic of Nigeria, and standing on all existing protocols, I extend a warm welcome, warm regards of the U.S. CDC and the U.S. government to congratulate the federal government of Nigeria and the National Primary Healthcare Development Agency on this remarkable achievement of the introduction of the human papillomavirus, or HPV, vaccine in Nigeria. This is a significant step towards achievement of the global strategy to accelerate the elimination of cervical cancer as a public health problem. Cervical cancer ranks the second most frequent cancer among women in Nigeria and second most frequent cancer among women of reproductive age in Nigeria. In Nigeria, there are approximately 12,000 new cases of HPV each year, and resulting in 8,000 deaths per year due to cervical cancer. The HPV vaccine can and will prevent many of these cancers and deaths in women. The decision to introduce the HPV vaccine in Nigeria is indeed a commendable and progressive one, reflecting the collective dedication of the Nigerian government as well as the United States government and collective partners to combat a virus that affects millions of individuals around the world. This milestone is a testament to the enduring partnership and an unwavering commitment between government and partners in improving the lives of Nigerian citizens. The tireless effort of the NPH-CDA team and the leadership of the federal and states ministries of health reiterates the federal government of Nigeria's efforts towards improving the lives of Nigerians, especially young girls and women and children. By providing access to this essential vaccine, you're not only safeguarding the lives of current generations, but also shaping a healthier future for young women and girls who will benefit from its protection. The vaccines are safe, effective, and free, and I urge parents and caregivers to avail their wards to receive them in designated locations as prescribed by the NPH-CDA. As we commence this journey to make the HPV vaccine accessible to eligible Nigerians, I offer my heartfelt congratulations and support, and have no doubt that this initiative will have far-reaching impact and serve as a beacon of hope for women across every community in Nigeria. Thank you and congratulations.
Thank you very much, USG. Ladies and gentlemen, we have with us the Gavi team, and it is now time for me to invite to the podium the Director, High Impact Countries and the Country Program Delivery, Dr. Tokunbo Oshin, to come up to the podium for his goodwill message. Can we applaud him as he steps up, please?
Your Excellency, First Lady, Republic of Nigeria, Senator Oluwami Tinubu, CON, ON, Excellencies here present, including my former boss, Honorable Minister of Health and Social Welfare, Professor Mohamed Ali Pate, the new ED, CEO, NPHCDA, and my brother, Dr. Muyi Aino, our royal fathers, guests, ladies and gentlemen. As a Nigerian, I'm proud to be back home today and to represent Gavi, the Vaccine Alliance from Geneva, to celebrate this historic occasion in Nigeria, the launch of the HPV vaccine. From Gavi, HPV is one of our most impactful vaccines, but despite this, it is not accessible to many of our girls in this country, therefore putting the lives of our daughters, our sisters, our wives, and our mothers at risk. And yet, it can be prevented, almost preventable, with a single dose of the vaccine. Therefore, from Gavi, we commend the Federal Ministry of Health and Social Welfare, NPHCDA, and our partners for embarking on this new path for Nigeria. We are proud to be part of this journey, and we are standing here with you as a partner to the government of Nigeria. For the past 2 decades, Gavi has worked side by side to ensure we make life-saving vaccines more accessible to girls and to our children. With today's introduction, we can do a lot more to address gender and equity gaps. That is why at Gavi, the Vaccine Alliance, alongside with our partners, we have set an ambitious goal for ourselves to reach 86 million adolescent girls with HPV vaccines by 2025. From Nigeria alone, we can reach over 16 million adolescent girls by 2025, which is why I'm here today. I'm proud to announce that my 13-year-old daughter, Anolua Keton, received the HPV vaccine in Geneva last year. I would like to see every Nigerian girl given the same chance to thrive and to fulfill her potential. But achieving this will require the government, our partners, parents, teachers, faith leaders, and society to work together. I urge communities to educate each other and to encourage and empower our girls. Going forward, Gavi wants to learn from your experience in Nigeria on how you have introduced this vaccine and to seize the opportunity for us to really invest in the health of our women and the future of our girls in Nigeria. Thank you.
Thank you very much, Dr. Oshin, for walking the talk. And your daughter is growing and growing well, so that should abate any fears about the vaccine. And moving on quickly, I'm talking about partnership. Perhaps one group of excellent women that have been together to ensure that immunization is accepted as one of the ways going forward is the First Ladies Forum, Wives of the Governors. In the last 6-7 years, they have come together to say that they would fight cancer to a stop still. And the chair today is a pediatrician, the former First Lady of Kebbi State, my sister, Dr. Zainab Shinkafi Bagudu, a pediatrician herself and a brand new grandmother. And I know that that's why we must hear her voice here. Please welcome with me the chairperson of the First Ladies Against Cancer movement, still working in spite of the fact that, well, she has transited into the wife of the minister. Welcome her, please.
Good morning, Your Excellency, the First Lady of the Federal Republic of Nigeria, our dear mother. A very good morning to the Honorable Ministers of Health, in particular, the Professor Pate, our royal fathers, my sisters, the First Ladies, and my sisters, the wives of ministers. Today I want to tell a story that a lot of people in this room might not be aware of. Many people see me and they link my face to cancer advocacy, and she's always making noise and trouble either at home or at work about cancer issues. For a very long time, I was deeply disturbed by the inequities, particularly around cervical cancer, and the fact that Nigerian girls were being denied this vaccine, despite the fact that it's a vaccine that has been available for over 18 years and has been shown to work, despite the fact that a lot of countries, including some African countries, were receiving this vaccination. So I would make a lot of noise in a very random way And one day I was sitting down with a colleague, a friend, and one of the leaders in MSD, the vaccine producing company, of whom we have heard from. And we were having a discussion on how we could do this and get the vaccine in as usual. And again, very randomly, in walks Professor Pate. We didn't know he was there, he didn't know we were there, but he just stumbled upon us in the lobby where we were having our meeting. And he sat down, greeted, and said to us, what are you discussing? And we told him, of course, when we saw him, at the time he was in Gavi. We immediately seized the opportunity to ask him, look, this thing is not happening. And he just said, but has Nigeria submitted a country proposal? Something so simple. We were busy just making noise on social media and everywhere we had the opportunity. And he said, I'll make 2 calls and I'll put you in touch with the right people. You do a country proposal first and then we'll see how it goes. Prior to this, of course, I had had several meetings up to the leadership of Gavi, the CEO at the time, Seth Berkley, and we didn't have this kind of reception. So during a subsequent visit to Switzerland, I met with Dr. Tokumba Oshin, who you have just heard from in Gavi, and within weeks he had deployed somebody. I believe he came to Nigeria himself, and the proposal was put together, and the rest is history. The lesson of this story is, despite the political will, despite the need, if we didn't have the right person, he actually used those words, to connect the dots, then we were not going to get it right. So I stand here today very happy, very pleased, and very excited as we embark on a new dawn. In Kebbi State, under the tenure of my husband, we were able to vaccinate girls in one of the local governments, Yauri local governments, and we were able to do this with a lot of help and intervention from the Emir of Yauri, Dr. Zayanu Abdullahi. That's why I'm very pleased today to see the inclusion in this program of our traditional rulers, His Eminence the Sultan, and my father, the Emir of Bede, as well as our religious rulers. They play a very vital role. We've started the vaccine, we're rolling it out, it's now available. The next task is to ensure that we have enough demand generation. We ensure that our communities understand what this vaccine is about and the ability to save lives that it offers. We've heard figures like 12,000 women die, or 12,000 women are diagnosed and 8,000 die every year in Nigeria. We all know that these figures are a gross underrepresentation of the real facts due to the weak health system as well as data collection system. The fact is that many women, many girls remain undiagnosed, unvaccinated, and untreated from cervical cancer in Nigeria. So it's a very proud moment for me as a Nigerian. I thank the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, for making this renewed hope happen under his watch. I thank all the partners that have made this possible, and I assure the NPHCDA and everyone that is involved in deploying this vaccine that we will continue to work with them to ensure that the right message gets to the grassroots so that we will see the elimination of cervical cancer in the near future. Thank you very much.
Thank you very much, Your Excellency, Dr. Zainab. I think it's also important to say partnership has played a great role to what we are witnessing here today. So before we have the next agenda, Your Excellency, the First Lady, Your Excellencies, all very distinguished ladies and gentlemen, I'd just like to reel out the partners that have been with us from day one until day of implementation. Shall we please put our hands together for Gavi, UNICEF, Bill and Melinda Gates, World Health Organization, USAID, MSD, AFNET, IVAC, Clinton Health Access Initiative, JSI, Momentum, UK Aid, World Bank Group, HAPPY, Chigari Foundation, CDC, Solina Health, Sidani Group, and the European Union. I think that applause should be very, very loud. Thank you so much for your partnership. But again, we are growing homemade partnership, especially across the line of our tradition and culture. And our traditional rulers have been in the forefront, and religious leaders, of helping to push the message and acceptance of any health intervention. It was done during polio, and today we all can say that Nigeria has been able to eliminate polio virus. And incidentally, the man who ensured that we bring the traditional and religious leaders as partners in progress is today the Honorable Minister of Health and Coordinating Minister of Social Welfare, my brother, Professor Bate. And so it continues, because that's what life is. And on your behalf, Your Excellencies, all distinguished ladies and gentlemen, I'd like to invite His Eminence, the Sultan of Sokoto, who believes in what we are doing, and he's been here all morning to ensure that this partnership is rather strengthened in every way. His Eminence, the Sultan of Sokoto.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على النبي الكريم. Your Excellency, the First Lady, distinguished ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Today is another historic day in our great country, Nigeria, where we're all gathered to fight a common problem of cervical cancer in our children. I'd like to thank Almighty Allah for making it possible for us to be here, and also for giving us the opportunity once more to make comments on some of these issues. September 29th at the National Mosque, we had the lecture to mark the 63rd anniversary of our independence. And in my comment there, one of my comments was, no government, no leader takes office to come and make life worse for the citizens. Therefore, when we find ourselves in any difficulty, we must come together to solve such problems. Instead of blaming governments, we have to sit together and find out what the problems are. No leader deliberately brings up things that will kill innocent citizens in any place, in any community. So today we're here for the launch of this vaccine. And almost 15 years ago, upon assumption of this office as the Sultan of Sokoto, as the President General of the Supreme Council for Islamic Affairs, as the Chairman of the National Council of Traditional Rulers of Nigeria, we had a lot of comments being said about polio vaccine. And we took it upon ourselves to put up a committee of senior traditional rulers in the northern states of Nigeria, where the problems had been there when people kicked against administering these vaccines to our children. 15 years ago, we started this. Within the first 1 year, the figures dropped to 1 digit from 3 digits. And that emboldened Bill Gates to come down to Sokoto to discuss with us how he could support. And through the Ministry of Health, and luckily for us also, the same person whom we work together to put this committee is the same minister now of Health. So it's a coincidence, and I think it's a very useful coincidence, because we all believe in the same thing. The health of our people is most important to us than any other thing. So coming together to talk about this launch today is also very important as religious leaders, because we know this is our day. When I say our day, I mean traditional and religious leaders. We are the ones who talk to our people, either through mosques and churches, or through our various communities as traditional leaders, and they listen to us much more than the politicians. So they know the politicians how they are. During campaigns, you see them. After elections, you don't see them. But they see us every day. And so the two institutions are most important in working with the governments at all levels to fight this menace. And I've seen how passionate Zainab had been. She called Emir Abadi as her father. She forgot that I'm the father of the Emir Abadi. And she's my daughter. I know she had been so passionate about it, so I think today will be her happiest day, seeing the launch of this vaccine. And I think it's something that all of us must come together to support. But when there are controversies, what do? We must educate our people. We must tell them why this vaccine is important. As much as we can not force people to take vaccines, like we did with polio, we didn't force people, but people accepted the polio vaccine. Today, polio is history in Nigeria, some 4 years back. The committee I put together is still working. We still meet with the MPHDC every time, every quarter. So the issue is we must come together to educate our people why health is important. Because health is wealth. And without being healthy, you can't even worship Almighty who created you to worship Him. So I think we have to go into such controversies. There have been controversies already from some clerics, both Christians and Muslims, about this vaccine. But we need to educate people. Through the Supreme Council, we have what we call MESH. It's an NGO we put together to educate our people on such things. Education, Social, and Health Mission. It's an NGO. So we have to, with the support of the governments at all levels, see how we can work to take this vaccine to nooks and corners of this country so that our children will be safe when they do grow up. But the controversies are there, but we must go into dousing such tensions, such controversies, and I believe the current president's comment too will come up. And I think the governors of all the states need to convene such programs with stakeholders, both traditional and religious leaders in the various states, to brainstorm on how do we really get this vaccine to be accepted by all, that they are harmless. Vaccines are harmless, yes, but do people believe us? So that's our work. For today's launch, which has been fixed for, I think, 24 to 28, needs to be also informed. We need to be informed too. After 24 to 28, we still go on with such programs. It's not the end, it's just the beginning. So we have to continue aggressively to go into nooks and corners, vaccinate our children, especially the young girls. I've seen so many when I was coming in here, and they are brought in here to hear from us that yes, these vaccines are not to kill them. If they are harmful and they are to kill you, we will not put our hands in such projects. Us as fathers, and let me add us as grandfathers too, because I'm also a grandfather. It's not only Zainab who is a grandmother. We must work to save our children. So I'd like to acknowledge the First Lady's passion and also the Minister of Health for bringing up this group of people, and also thank our supporters, our stakeholders, like all the WHO and UNICEF and others who have been working with us in the last 15 years to ensure we have a healthy community. We need healthy people to make a healthy nation. And it's only a healthy nation that can be a developed nation. If we don't develop, instead of retarding, then the problem will be much, much worse. insecurity issues are there, but you have to be healthy. I would like to thank all of you for coming, and I'd like to acknowledge the efforts of the Minister of Health and the Primary Health Care and the new DG or the Executive Director who just took over some few hours ago. You have your plate full, but we are here for you just as we worked with Ali Pache when he was in the same office. Today he's your boss, he's your friend. We are also your friend. We are going to work for the sake of our children, for the sake of our great country, Nigeria. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, Your Eminence. You will notice that for the most part, His Eminence spoke from his heart, and that is a clear reflection of who he is, a passionate and committed supporter of healthcare interventions in Nigeria. We thank you very much, Your Eminence. Can we applaud him once more as he takes his seat? The role of traditional leaders in promoting healthcare in Nigeria cannot be underestimated. And it is on that note I'd like to invite to give goodwill messages His Royal Majesty Igwe Ambassador Lawrence O.C. Agbuzu. He is the Eze Obunechendo of Ezema Olo Kingdom, and he is also the Chairman, Southeast Traditional Committee on PHC Delivery. Please, can we applaud him as he comes up to give his goodwill message? Your Highness, you have our attention.
Thank you very much. Your Excellency, the First Lady of the Federal Republic of Nigeria, Your Eminence, the Chairman of the National Council of Traditional Rulers of Nigeria, I thank you for making my job easy, because I don't have to speak much. You've said everything. I only want to appeal to our partners who are here to know that by bringing this launch into the seat of government in Nigeria, Nigeria attaches great importance to it. And you should do everything possible to support our government and people so that this vaccination will be successful. As traditional rulers, we are committed to ensuring that this vaccination is successfully carried out in the country. We will take the message home and make sure that it reaches all the parts of this country. I thank the Ministry of Health for making this occasion possible. We will work with them and ensure its success. I thank you.
Thank you very much, Your Royal Majesty. Ladies and gentlemen, also part of the great support we get for primary health care in Nigeria is from the Christian Association of Nigeria. Please, can we warmly welcome the President, Archbishop Oko, as he steps up to give his goodwill message.
Your Excellency, Senator Oluremi Tinubu, the wife of the President of the Federal Republic of Nigeria, the mother of the nation, Your Excellencies, Your Majesties, honorable ministers, distinguished ladies and gentlemen, I bring you warm greetings from the National Secretariat of the Christian Association of Nigeria, and I express my sincere gratitude to the Federal Ministry of Health and the National Primary Health Care Development Agency for inviting me to this epoch-making event. I would like to extend our warmest congratulations to the federal government, especially to the President of the Federal Republic of Nigeria, His Excellency Senator Bola Ahmed Tinubu, for integrating human papillomavirus vaccine into the routine immunization program in Nigeria. This is a significant milestone in the fight against the life-threatening disease and a testament to our commitment to promoting the health and well-being of the Nigerian population. The introduction of the HPV vaccine is a vital step in preventing the transmission of this virus, which is said to be the leading cause of cervical cancer among women. By making this vaccine accessible to the people of Nigeria, you are providing our girls a powerful tool to safeguard their health and protect their future from this devastating disease. Now, we have had fears being expressed in certain quarters that this vaccine is not safe, especially when it is taken at a certain age. But I stand here as the leader of the Christian community in Nigeria to say that having had interactions with our experts, whom we consider as God's gift to Nigeria, we have seen that this vaccine is safe, and it is safe to be taken, and it is not a threat to the life and the health of our people. We have to believe our experts. We have to believe people that God has placed in authority over us. Just like His Eminence, the Sultan of Sokoto, had mentioned, there is no responsible government that will give poison to its people. And I know that the people in government are making very serious effort to see that we have a healthy population. And so I want to believe that this is a very laudable program, and we all have to embrace it. Of course, we know that each time such new programs come out, many of our people would not want to embrace it immediately. But I want to say that this one is something that God has given to us at this time to save the lives of our women. I want to congratulate especially our dear sister, Dr. Zainab, for the great work you have been doing. I've heard about you so much. I've seen your work. I've seen your laboratories. And I can tell you that your name always goes before you. The Lord, God has actually rewarded your efforts today. Congratulations. The Christian Association of Nigeria, therefore, will lend our support to this program by creating awareness on the importance of this immunization, using our elaborate structure in this country that covers all levels up to grassroots level, to use our unique role as faith leaders to give a veritable voice, a very strong voice, to reach the wider audience and influence for the positive change that is desired from this particular program. And we want to say that Christian Association of Nigeria, being very particular about the health of our people and about the well-being of Nigerians, we stand with you we stand with you on this critical initiative. We are confident that with your guidance and the collaboration of healthcare professionals, policymakers, and community leaders, the HPV vaccine will have a profound effect on the health and well-being of the Nigerian population. Once again, congratulations on this momentous occasion. Your dedication to improving public health is an inspiration to all, and we look forward to witnessing the positive outcome that will stem from the launch of this vaccine in Nigeria. Thank you for your kind attention.
Thank you very much. Thank you, Archbishop, and your commitment and your promise to be part of this wonderful partnership and history making we're witnessing here today. The First Lady and Mother of the Nation, Your Excellency is all here present, very, very distinguished ladies and gentlemen, and of course, the media. He's stepping out, doing his first assignment, and I think he's one of the luckiest because he's coming out and setting history. Our next speaker is a certified vaccine science expert. He is also a public health expert and also a consultant that deals with management policies and making them work. It's a proud moment for me to invite to the microphone my younger brother, Dr. Mui Aino, Executive Director, Chief Executive of the National Primary Healthcare Development Agency. Congratulations. Congratulations.
Thank you very much, Auntie Moji. Your Excellency, First Lady of the Federal Republic of Nigeria, and our mother, Senator Oluremi Tinubu, CON, Excellencies, Executive Governors here present, the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, my boss, the Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa, all honorable ministers here present, Excellencies, wives of governors present here, the wives of ministers present here. I'd like to call Hajia Karimatu Pate, the wife of my honorable minister. His Eminence, our father, the Sultan of Sokoto, whom we have heard from, other royal fathers present, the President of Cannes, who also spoke earlier, and other religious leaders present here. Honorable essay to the President on Health, Dr. Salma Anaskolo, CEOs of parastatals here present. I see the DG of NCDC here. Donors and development partners, CSOs here present. Directors and colleagues at MPHCDA. Nigerian children here present, for whom the day is being held. Gentlemen and ladies of the press, distinguished ladies and gentlemen. First, I would like to express my gratitude to His Excellency, the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, for supporting the Federal Ministry of Health and Social Welfare and the National Primary Healthcare Development Agency to make this life-saving vaccine available to our girls. I would like to recognize the leadership of the Coordinating Minister of Health and Social Welfare, Professor Pate, the leadership of our traditional and religious leaders, and of course the invaluable contributions of all of our development partners, all of which has come together to make today a reality. It is indeed my honor to address the nation today on the HPV vaccine rollout in Nigeria. And I thank each of you for gracing this occasion with your presence. I stand before you today with a profound sense of optimism as we embark on a journey that holds great promise for the health and well-being of our girls. The human papilloma virus, or HPV, as it is popularly called, is a global health concern. It is responsible for approximately 95% of cervical cancer cases worldwide. In Nigeria, the impact of the human papilloma virus is sobering. Over 56 million of our women are at risk of the infection. Every year, we diagnose more than 12,000 cases of cervical cancer, and every year we lose about 8,000 of our women to the disease. It is the second most frequent cancer among women in Nigeria, particularly those that are aged between 15 and 44 years old. Approximately 3.5% of women in the general population are estimated to already harbor the HPV type 16 and 18 infection. And these two strains actually cause 7 out of 10 cases of invasive cervical cancer in our population. Your Excellencies, ladies and gentlemen, these are not just numbers. These are our mothers, our sisters, our daughters, our friends. It is imperative that we act swiftly to address this pressing issue. Fortunately, we have an effective intervention that can effectively prevent this burden of disease and deaths. The introduction of the HPV vaccine into our routine immunization schedule is indeed a monumental and necessary step towards the prevention of this devastating disease. I am pleased to again announce that Nigeria is taking a decisive step in the direction. We have set today, October 24th, 2023, for the commencement of the HPV vaccine rollout, which will happen in phases. The phase 1 states start immediately, and we are planning for phase 2 states in the first quarter of next year. This is a momentous occasion that underlines our commitment to the health and well-being of our nation's women. With this introduction, we aim to provide protection to the most vulnerable among us and strive to reduce the burden of cervical cancer. I call upon all stakeholders, really just building on all of the goodwill messages that we have heard, healthcare professionals, civil society organizations, parents, community leaders to join hands with us in this noble endeavor. Together, we can ensure that every child who is eligible, which is really every child between the ages of 9 and 14, receives the HPV vaccine, and we can create a future where cervical cancer is no longer killing us and is not a threat to our women anymore. I want to assure you all that the National Primary Healthcare Development Agency is fully committed to providing the necessary resources, the guidance and technical expertise to facilitate the successful rollout of the HPV vaccine. We will work hand in hand, as we have always done, with all of you, all of the stakeholders, drawing on your invaluable knowledge, your experience, and specific expertise to ensure that no girl is left behind. I want to appreciate you all for your presence here today and for your dedication to the well-being of our citizens, and specifically our children today. Together, we can make history by eliminating cervical cancer as a public health threat in Nigeria and protect our daughters and our mothers from suffering from this disease. I also want to thank my colleagues at the National Primary Healthcare Development Agency, and specifically my predecessor, Dr. Faiza Shuaib, for the dedication and work that has gone into making today a reality. In conclusion, thank you. In conclusion, the introduction of the HPV vaccine into our routine immunization schedule is a giant leap towards a healthier and brighter future for our nation. Let us stand united in our mission to protect our women from this silent but deadly adversary. Together we can make a difference, we can save lives, and we can secure a healthier future for Nigeria. Thank you. May your efforts be blessed, and may we embark on this journey together with determination, compassionate, and the unwavering belief that we can create a healthier, brighter future for Nigeria. God bless you all, and God bless the Federal Republic of Nigeria.
Thank you very much, Dr. Mui Aino. Only yesterday, the National Institute for Cancer Research and Treatment, NICART, launched the National Cervical Cancer Control Plan, and it was launched by the Minister of State, the Federal Ministry of Health, Dr. Alausa himself, and I'd like to invite you to the podium. Thank you.
Thank you, Auntie Moji. Your Excellency, First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu, I'd like to especially thank you for finding the time to honor and grace this occasion. It means a lot to our country and also the young girls that will be getting this vaccination, and also to their mothers and sisters. Thank you for coming. Coordinating Minister for Health, Professor Ali Pate, and other ministers present here today. Excellencies, wives of our various state governors present, and the chair lady of the Forum of Governors' Wives, His Eminence, Sultan of Sokoto, members of the National Assembly present here today, religious leaders, and President of the Christian Association of Nigeria, the Special Advisor to the President on Health, Dr. Anas, Commissioners of Health of various states who are present here today, Permanent Secretaries, agencies head, directors, and our development partners, as well as members of the press. Distinguished ladies and gentlemen, today marks a significant milestone in our relentless commitment to improving the health and well-being of our nation. I stand before you today with immense pride as we gathered here for the official launch of the human papillomavirus vaccine in Nigeria. First and foremost, I would like to express my profound gratitude and appreciation to the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, who has provided the enabling environment to ensure that all Nigerians have access to a broad spectrum of vaccine. And I would also like to express our thanks to all our national and international stakeholders, partners who are present here today and who have joined us during this momentous occasion as we introduce a new vaccine to our national immunization schedule, the human papilloma virus vaccine. Your presence underscores the importance of the cause we champion today, and we're truly honored to have your support. The introduction of the human papilloma virus vaccine to our national immunization schedule represents a proactive step towards a healthier future for our beloved nation. As we embark on this journey, let us reflect the significance of this moment. The human papillomavirus vaccine is a global concern that affects individuals worldwide and is responsible for approximately 95% of cervical cancer, making it one of the most prevalent sexually transmitted infections globally. Women aged 15 years and older, numbering over 56 million, are at risk of developing this preventable cancer. Cervical cancer ranks as the second most frequent cancer among Nigerian women, particularly age 15 to 44 years, who are most vulnerable to contracting this disease. The federal government of Nigeria, in alignment with member states, is committed to achieving universal health coverage and sustainable development goals with a pledge to leave no one behind. The knowledge and tools to prevent suffering and death from these preventable diseases are known. We're all delighted to announce that Nigeria has taken a decisive step by implementing enabling policies and guidelines for the commencement of HPV vaccine rollout, which we're celebrating today. This underlines the government commitment to the health and well-being of our nation's women and aims to reduce the burden of cervical cancer in our society. We envision that all stakeholders, including healthcare professionals, civil society organizations, parents, community leaders from both the private and public sectors, will unite with us to reach the target ages 19 to 14 years as Nigeria expands the scope of its immunization schedule. Together, we can create a future where cervical cancer is no longer a pervasive threat to our women. In conclusion, the introduction of the HPV vaccine would focus on vaccinating 90% of girls through our national routine immunization schedule is a testament to the success of government policies and guidelines, ensuring that every child, especially the girl child, is given access to a healthier future. Thank you. May God bless the Federal Republic of Nigeria as we embark on this journey together.
Thank you very much, Honorable Minister, sir. The provision of vaccination for our children cannot be easily carried out without the cooperation of the education sector, especially for a vaccine as the HPV that is targeted at girls ages 9 to 14. It is on that note, to register their commitment, I would like to invite to the podium for a goodwill message the Honorable Minister of Education, Professor Tahir Maman, SAN-OON, who is ably represented here by Mr. Ojumba Peters. Please, can we applaud him as he comes up for his goodwill message?
Thank you. Good afternoon, Her Excellency, the wife of His Excellency, the President of the Federal Republic of Nigeria, our mother, the Coordinating Minister for Health and Social Welfare. Permit me to stand on the existing protocol. My name is Ojumba Peters. I am representing the Honorable Ministers of Education, Professor Tahir Maman, Senior Advocate of Nigeria, OON, and Honorable Dr. Yusuf T. Sununu, Honorable Minister of State for Education. I am delighted to present a remark on behalf of the Honorable Ministers of Education on the occasion of the national launch of the human papilloma virus vaccine introduction into Nigerian routine immunization schedule. As the federal government is set to commence the HPV vaccination of young girls between the ages of 9 and 14 years to prevent HPV infection and reduce the risk of cervical cancer, it should be stated that for any meaningful result to be achieved, we must use two approaches. One is the community-based approach, and the second one is the school-based approach. Many of these girls, 9 to 14 years, are in school. School settings have been found to be where we can have a larger concentration of students at a time. They are agents of change and influential in decision-making in the household, family, and communities. The ministry will continue to improve on the implementation of a comprehensive school health program and ensuring effective adolescent health service and health education activities are provided for. The well-being of learners and effective learning outcomes in school, as well as increased enrollment, attendance, retention, completion, and transition in the school system is achieved. Education will continue to provide access to information, allows for informed decision-making, and empowers individuals to make their own independent choices. Education and health are intertwined, as healthier children are able to learn, and education provides the basis for healthier lives. The registration approval of Gardasil vaccine as a single dose by NAFDAC is a welcome development in view of where we were. Around 2014 to 2015, the Federal Ministry of Education has been part of the technical working group on HPV vaccine that went through the rigorous HPV demo application process to Gavi. The rest is history. Thank God that today, nearly a decade after, Nigeria is able to launch the HPV vaccination across the country in batches. I am using this opportunity to call on government at all levels to increase their prioritization of our students' health and adopt country's roadmap to address policy bottlenecks and increase effective implementation. As part of the United Nations Convention on the Right of the Child, we put children first, giving their needs the highest priority, including creation of a healthy environment for teaching and learning to take place. Schools and government play an important role in ensuring the implementation of targeted educational and health programs, including teacher training, social mobilization, which is key if vaccination is to occur through schools, and curriculum development, which address adolescent health services, especially for girls. The ministry has been providing an enabling environment to the Federal Ministry of Health and Social Welfare, the National Primary Healthcare Development Agency, for the conduct of vaccine-preventable diseases like measles, yellow fever, and now HPV. Finally, I wish to congratulate the Coordinating Minister of Health and Social Welfare, the NPHCDA, and indeed all Nigerians on the successful launch of HPV vaccine and its introduction into the Nigerian Routine Immunizations Program. Thank you for listening, and God bless you.
We appreciate you, and we know that the education sector is one of the sectors that would need to work with to achieve all the goals and aims and the aspirations of this launch today. And Mother of the Nation, ma'am, you have your children here. All the students and all the school children, the girls that are here, can you all stand up? It's your day. And let's applaud them. Yes, they're all seated there, and they've been here all morning. Thank you. We are moving on quickly. At this point, the man of the moment, the Honorable Coordinated Minister of Health and Social Welfare, Professor Muhammad Alipate, CON, will address us next. Please, let's welcome him most warmly, the man who has history on his side. Congratulations.
Your Excellency, the First Lady of the Federal Republic of Nigeria, the Chief Mother, the Mother of our nation, Senator Oluremi Tinubu, His Eminence, the Sultan of Sokoto, and Royal Majesties that are here with us, His Eminence, the President of Cannes, His Excellencies, the Executive Governors that are here. I know that Zamfara, Kano, and Borno are represented here. My brother, the Honorable Minister of State for Health, and the Honorable Ministers who were here but have now left us to attend to the National Economic Summit that is ongoing. We have several things all going at once. The Excellencies, the wives of the executive governors of our country, led by the chairperson of the Forum of Governors' Wives, the wives of the honorable ministers that are here, my sister, my senior sister, the Special Advisor to the President on Health, Dr. Salma, our development partners from all over the world who are here with us, especially those who flee from Geneva, the Global Alliance for Vaccines, WHO, UNICEF, the staff of MPH-CDA, and importantly, the future of our country in the young girls and students who are here with us, members of civil society, and all dignitaries that are here. Distinguished ladies and gentlemen, good afternoon. I would like to start by thanking you for making the time, and especially our dear mother, who, despite her very busy schedule, signaled the significance of this by making time to be with us and to be here to see the launch of this HPV vaccination. Ma, we're very grateful for you to be here with us. But all of you, including our royal fathers and all distinguished dignitaries who have spent this time to signal to the world that Nigeria is serious about the health and well-being of its children and will need to protect them. So I appreciate all of you. I think Mr. President's vision for this country is to have a prosperous country that is including everyone. That is at the core of his renewal of hope agenda, and with people at the center of that agenda. And as His Eminence the Sultan mentioned, a healthy people leads to a wealthy nation. And I think that is very much in alignment with what our president also believes and has tasked all of us in his government to drive. And health can be a basis for unifying this country, for healing this country. And the launch of vaccination, as we had seen with polio, with immunization, and now with HPV, is an opportunity to bring all of us together. Because HPV as a virus or any other vaccine-preventable disease doesn't respect borders, doesn't respect your tribe, your language, which state you are from, where you pray, all of those. Health can be a basis of unifying us. Now, beyond that, HPV is an important disease, and several speakers alluded to the burden of cervical cancer among our women, and we have an opportunity to stop that, to eliminate it. And the vaccine that we are launching today is one piece of the puzzle, in addition to screening and early detection to prevent it. And here I will really thank all those who have built this momentum over the years, and call out in particular Her Excellency Dr. Zainab Bagudu for her incredible leadership in trying to move Nigeria, even before I knew I will come back to this ministry to see this launch. So thank you, Your Excellency, for your leadership on that. The vaccine we're launching is safe, it's effective, it's been delivered in countless numbers of countries. Unfortunately, it's taken a long while to come to Nigeria. As a father, I did ensure that all my 4 daughters had HPV vaccine when they were in the ages where they are eligible. And my wife is here, she can testify to that fact. And I believe that no father or mother who really understands that they can prevent a very deadly disease for their daughters will willingly refuse to allow their children to be vaccinated, except if they don't fully understand it. While the vaccination is voluntary and consent will be obtained for parents, but we know that this vaccine is safe and will protect our children from getting this deadly disease. I want to encourage all stakeholders, parents, community leaders, religious leaders, health providers, all of us as stakeholders in this Nigerian project to work hard to ensure that we immunize all eligible children against this deadly disease. From the government, I assure you that Mr. President and his team are very committed to earning the trust of Nigerians. We'll work towards that so that the deficit will be minimized. When we bring a vaccine, a therapeutic, an intervention that will benefit people, I believe over time people will realize that in fact these are things that have tremendous benefit for our population, and we'll work hard to earn the trust of Nigerians. Once again, thank you all very much, and especially the hardworking staff of the NPHCDA, who have worked tirelessly for countless numbers of hours in the period leading up to this, including Dr. Mui's predecessor, Dr. Faisal Shuaib, who has been an incredible partner in terms of bringing us to where we are today. And God bless the Federal Republic of Nigeria. Thank you very much.
We thank you very much, Honorable Coordinating Minister Sir, for your kind and consistent leadership. Thank you so much. Ladies and gentlemen, you will agree with me that a launch of this nature is worthy of celebration, considering the positive impact it will have on our children and our nation, Nigeria. It is on that note that I would like to invite, in the spirit of celebration, the Unity Troupe as they come out to perform a dance in celebration of this event. Please, can we welcome the Unity Troupe?
Would like to welcome the Coordinating Minister for the Economy, Mr. Wale Edu. He just came in. Thank you so much. I think this is an endorsement of the fact that we will have a continuum of the vaccine, the availability of the vaccine. If we have the Coordinating Minister for Economy here, the finances to do that, I'm sure government will make available. You're welcome, sir. Quickly, can we have the entertainers? You have only about 5 minutes. Thank you very much. Thank you. Wow, those dance steps are good for aerobics. Maybe we need to export them. We're moving on quickly. Just want to quickly say that as we celebrate my sister, Dr. Zainab Bagudu, today, I would also like to mention that we'll celebrate Her Excellency, the wife of the Executive Governor of Ondo State, that has championed awareness creation for cancer awareness for Brecon. Ma'am, yes, we celebrate you. We're moving on quickly, and this is the moment of history. Very distinguished ladies and gentlemen, Your Royal Highnesses, His Eminence the Sultan, honorable commissioners here present, indeed ladies and gentlemen, and of course our girls who are also here, and wives of executive governors led by the chairperson of the Nigerian Governors' Wives Forum, Professor Abdulrazak. Today, the world is watching, and as we move to implementation that will go around the states, and I hope will also influence Africa, I'd like, on behalf of all of us, to invite the First Lady, Federal Republic of Nigeria, Her Excellency Senator Oluremi Tinubu, CON, who will declare this history open and, most importantly, ensure that every girl in Nigeria, as planned, would be reached. Your Excellency, ma'am.
Thank you. Please, can we be seated? Thank you. The Coordinating Minister of Health and Social Welfare and our host, Dr. Mohammed Ali Pate, CON, and I think I'll recognize your wife, Mrs. Pate, Honorable Minister of State for Health, Social Welfare, Dr. Tunji Alausa, the Honorable Minister of Finance, Honorable Wale Edo, the Honorable Minister of Education, ably represented here. He was here this morning, and I think this nation have a lot of activities going on at the same time today. So I think that's what our people expect us to be doing. Wives of governors and First Ladies of various states that are here, wives of Honorable Minister, the Executive Secretary and Chief Executive Officer, National Primary Health Care Development Agency, Dr. Muyi Aino, other top government officials and development partners and stakeholders of the Ministry of Health and Social Welfare here present, our revered traditional rulers and royal fathers, particularly His Eminence, the Sultan of Sokoto, Sultan Sahad Abubakar, CFR, the Khan President, His Eminence Archbishop Daniel Oko, our youth and children here present, our dedicated health workers, distinguished guests, ladies and gentlemen. We are here today to present the introduction and incorporation of the human papilloma virus HPV vaccine into Nigeria's expanded program on immunization schedule. This action alone marks a significant milestone in our nation's healthcare system. Before we go into the business of why we are all here, I would like to take a moment to express my gratitude to the dedicated and tireless efforts of our healthcare professionals and partners, and all those who have contributed in making this event possible. The Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, I thank you for inviting me to be part of this momentous step in the government's commitment to safeguarding the health and well-being of our young girls and women. The global burden of cervical cancer has been of significant public health concern for several decades, affecting communities in every region of the world. In 2020, an estimated 604,237 women were diagnosed with cervical cancer worldwide, with about 341,843 women dying. 90% of these were in less developed regions of the world, where access to prevention, screening, and treatment services is limited. In Nigeria, it is the second most common cancer among women and the second most common cause of cancer death amongst women ages 15 to 49 years, claiming about 8,000 lives yearly. The human papilloma virus is the most common viral infection of the reproductive tract and has been identified as a cause of 95% of cervical cancer cases, therefore making it preventable by vaccination. Based on these statistics, the introduction of the HPV vaccine into our routine immunization schedule is very crucial and thus shows our commitment to the World Health Organization global strategy of 90-70-90 to eliminate cervical cancer by 2030. And this means for vaccination, 90% of girls fully vaccinated with HPV vaccine by the age of 15. For screening, 70% women screened using a high-performance test by age of 35, and again by the age of 45. For treatment, 90% of women with pre-cancer treated and 90% of women with invasive cancer managed. With the introduction of the HPV vaccine into our routine immunization schedule, we are making a clear statement that the well-being and health of the girl child is a national priority, and this is in line with the renewed hope agenda of His Excellency President Bola Ahmed Tinubu, GCFR. This initiative goes beyond preventing cervical cancer, but also demonstrating our commitment to gender equity and empowering our young women to take control of their health. The initiatives does not end with the introduction of the vaccine into our routine immunization schedule, but we must focus on education and awareness of the virus, encourage regular screening, improve access to health care, behavioral interventions, and early detection. For me, I would recommend that girls who are under 18 years of age, sexually active, avail themselves with the opportunity of this vaccine to avoid a future of ill health and possibly death. As we launch the first phase of this program, which will encompass 15 states of the Federal Capital Territory, FCT, I wish all our health workers success as they go about this exercise. In conclusion, I want to emphasize that the introduction of HPV vaccine into our routine immunization schedule is a significant step forward in our mission to protect the health and future of our nation's women folk, and it will lead to structured and systematic way of achieving a cervical cancer-free generation. And it is my singular honor and privilege to launch the first phase to the glory of God and the benefit of all our women folk. Thank you for listening. God bless the Federal Republic of Nigeria.
Thank you, Your Excellency. Will now lead the Mother of the Nation to the implementation table. Yes. Would also like to know that the Senior Special Advisor to Mr. President on Health, Dr. Salma Ibrahim Anas, will deliver the vote of thanks on behalf of all of us.
Like I said, to the glory of God, to the glory of God and the benefit of our young, beautiful ladies and the women folk, I hereby launch the first phase.
Yeah, the two of them are taking.
I want to do the little baby first.
Okay.
Just stand with her.
Thank you, sir.
I'm just standing with her.
All right, ma. Thank you.
That's why we have to. So I'm going to be here. We'll do her first.
Yes.
She doesn't speak English.
She's out of school.
Okay, out of school. Shedding a tear. You see, it's over. You cry now. Does she need a bandage? No, for me.
No, ma, it's fine, ma.
She doesn't need bandage. Go and wait for some gift from me. She's a strong girl. Thank you very much.
May I please invite the Senior Special Advisor to Mr. President on Health to come to the podium as she would move the vote of thanks. Dr. Salma.
She is. She's a big girl. And we're just going to support. We're just going to support her.
Yes.
And I'll give you just rub on your back. Oh, that's a champ. That's a champ. Then she'll put it on a little bit.
Yeah, put your hand down.
Okay. So because you don't need the bandage with it.
No, ma'am. Yes, ma'am.
We would appreciate it if the Senior Special Assistant to the President on Health, Dr. Salma Anas, please come to the podium now to deliver the vote of thanks. Thank you very much.
They are the ones. They are the ones. Let me call. Just go ahead because. Oh yeah, that's what.
Currently ongoing, ladies and gentlemen, is the administration of the HPV vaccine by the First Lady, the Coordinating Minister of Health and Social Welfare, and the Honorable Minister of State for Health and Social Welfare, and the Executive Director and CEO, NPHCDA. Ladies and gentlemen, it is now time for us to take the vote of thanks. Please join me as I welcome to the podium the Senior Special Advisor, to the President on Health, Dr. Salma Anas, please.
Thank you very much, Your Excellency. Can I go ahead? Is she sitting? Okay, Your Excellency, the Mother of the Nation, the wife of the President of the Federal Republic of Nigeria, distinguished Senator Oluremi Tinubu, the initiator of the Renewed Hope Initiative, the Coordinating Minister of Health and the Minister of Health, His Eminence Sultan of Sokoto, His Royal Highness, our Royal Father seated. She's sitting. Let me start all over again. At least if she's sitting, let me start all over again. Your Excellency, the wife of the President of the Federal Republic of Nigeria, our President, President Bola Ahmed Tinubu, the Mother of the Nation, an initiator of the Renewed Hope Initiative, mostly to reach vulnerable people in Nigeria. Our coordinating minister, Professor Pate, and the Minister of State for Health, Dr. Alausa, Dr. Pate and his beautiful wife, amiable wife here, Hajia Karima, the wives of governors, Your Excellencies that are here, the governors of the states, the 15 states and their wives, represented by their wives, and also some represented by their commissioners of health that are here with us, honorable ministers that are here, the coordinating minister of the economy, Dr. Wale Edu, our royal father, His Eminence, the Sultan of Sokoto, our royal fathers that are seated here, our development partners, our brand new, the Executive Secretary and the CEO of the National Primary Healthcare Agency, all ambassadors of cancer, fight against cancer that are gathered in this room, my sister Hajia Zainab, Your Excellency, the President of the Cancer Society, and all cancer advocates and champions, and all participants. I will not be able to mention all of you. You are welcome. And I want to say my task here is to say a big thank you to all of you. I've been delegated by the minister to do so. It was supposed to be done by the permanent secretary. Unfortunately, she's not here. So I want, on behalf of the Honorable Minister of Health, the coordinating minister and his team, to appreciate all of you for attending this memorable event. Indeed, it is a memorable event for us. It is a huge milestone in the health sector development in Nigeria, because this has been our desire to ensure that we protect, we promote, and prevent cervical cancer and all other forms of cancers amongst Nigerians, especially vulnerable Nigerians. It is indeed gladdening to see that we have marked this landmark today. And this coincides also with the first assignment of our brand new Chief Executive of the National Primary Healthcare Development Agency. And I want to say a big congratulations for her hosting a successful event. As a mother, I will not say I'm a grandmother. As a mother and a sister and a health worker, in fact, it gladdens my heart for us to be commemorating this very important event today, and to integrate it within the expanded immunization activities in Nigeria. And this fully aligns with the President Bola Ahmed Tinubu Renewed Hope agenda, which is aimed to ensure that no Nigerian is left behind. All Nigerians have access to quality healthcare services across all the spectrum of healthcare services, from health promotion, disease prevention, treatment, care, and rehabilitation. And this is a true demonstration of the desire and aspirations of our President, President Bola Ahmed Tinubu, in delivering healthcare services in Nigeria. And I congratulate our Honorable Minister and his team for taking this to action. We've been talking about it. Zainab has told us his heart has been in Nigeria. Even while he was not here, he made the connection of all the dots. And here we are today, within the very few weeks of the administration. We are today marking a very important and innovative approach to improving the health of Nigerians, especially the health of women and children. So, Your Excellency, we really appreciate you taking your time to be with us at this very important event. And we strongly believe you're going to be our champion. You're our partner already in the struggle to ensure that women and children have access to quality health services as a gateway for them to make meaningful contribution to the national development, which we all desire. And I strongly believe in the next 4 years, we're going to close the gaps. We're going to close the gender gaps, inshallah, to see that women are at the same level of national contribution to the national development. And our girls are well protected, whereby there will be no girl on the street or roaming around the street without education. And girls will also have access to take decision on when to get married, who to get married to, the number of children they want to get married to, and have access to all the unblock all their potentials to have access to all the national development. Thank you so much. Our royal fathers, you are also our #1 partners. The Sultan has already said it all. You are always there forever. You are the custodian of the citizens. You are the custodian of the people. And once you stamp it, definitely you will not stamp and endorse anything that will be harmful to your community. We want to say a big thank you today, and we are also assuring you that we are going to build on the existing structures and the existing efforts that you have put in place that took us to success in the celebration of polio elimination in Nigeria. And thank you so much, and I want to say thank you to everyone that is here, and wishing you all a safe journey back to your destinations. And the journey has just started towards promotion of health and prevention of cancer, and also providing access to treatment. The slogan is 90-70-90. So this is what we should take home today. 90, access to vaccines. All our girls, 9 to 15 years, must have access to the vaccine, 90% of them. And I'm sure Nigeria can do 101%. 70% of women should have access to screening within their reach, not far away from them. And we've heard this can be done in the health facility that is closest to you. It can be done in the schools and even in the marketplaces. And then 90% access to treatment for those who have been detected to have cancer, either at the initial stage of the cancer stage or at whatever stage of it. We want 90% of women to have access to treatment. So with this, I said a big thank you and safe journey to you all.
Thank you very much. And history has been made. We'll keep tracking the progress of it and ensuring that all eligible girls are able to be vaccinated in the first 15 pilot states, including FCT. Thank you. Your Excellencies, all very distinguished ladies and gentlemen, can we please rise for the national anthem? keep standing while Her Excellency, the First Lady, and members of our entourage will take leave of us. There will be a refreshment for our very important guests just opposite where I stand, and thereafter the ushers will direct. Please, we all remain in the hall until, of course, we get further announcements on where we will be entertained. May I also invite Your Excellencies, the wives of the executive governors, to please just go to the VIP room where you would also be entertained with refreshment, and of course followed by the wives of the honorable ministers. Thank you. Have a good day in Abuja as I call Nusa to give further directives.
Thank you very much, Auntie Moji. Ladies and gentlemen, as the VIPs take their leave to have lunch and are guided by the ushers, I'd like to announce to us that we will be having our lunch in the Dome. All other distinguished personalities here will have their lunch at the Dome and will go through the other door. Thank you very much and have a safe trip to your various destinations.